So you've recorded your cases, planning to submit for the RCA. Before you submit them, it's important that you make sure that you're aware of the common pitfalls. Because if you're not aware of them and select the wrong cases or cases that's not going to score well, then it can make the whole difference between passing and failing the RCA. In this video, I'm going to share with you a coaching session where we discuss the strategies so that when you're going to select your cases, you're going to make sure that you avoid common pitfalls. Watch this video. The beauty of the RCA is that you have complete control over what cases examiners can watch or listen. So make sure that you use that to your advantage, right? Because previously with the CSA, you couldn't do that. Whereas now you can actually select yourself which cases to submit and which cases you don't want anybody to see. I want to remind you, because it's so important, because I see registrars doing that time and time again, to avoid any low challenge cases and avoid follow-up cases where possible, okay? Because low challenge cases, what they're going to do is that they're going to cap your marks because there's not enough evidence for the examiner to score you well, even if you've done the best you can, because a case does not have anything that will help examiners to tell them whether you're safe for practice and you can practice as an independent GP. You need to put yourself in the shoes of the examiner. What I mean by that is when you're actually doing this selection for the submission, think from the lens of an examiner. If you're going to plan an OSCE for GP trainees, what stations are you going to put in that circuit? What 13 stations are you going to put? And think about what are you testing in each of these stations. So that will help you to think about your cases, whether there is something that the examiner could be testing in there. So these include negotiation, patient making unreasonable requests. It could be breaking bad news. If you're doing a USC referral, it could be discussing mental health case where there is some risk. So making a risk assessment and managing psychiatric case safely. It could be how you manage chronic condition where you need to make sure that you have good consultation skills to get the patient to self-manage and use lifestyle modification changes. So these would be angles that you're thinking about when you're selecting your cases. The next thing that's very important is when you're marking your cases, you need to mark them against the benchmark, which is the marking sheet. Don't just read it and then just mark it as you would without paying much attention. So you need to actually reflect on the marking sheet and think whether this is justifiable and whether you actually score a clear pass or a fail. So this is very important, the nuances, because the more specific and the more attention to details you have in this process, you're more likely to have an accurate marking to what the examiner is going to give you. You need to be as critical as possible. What I mean by that is you need to be very objective. When you're reviewing your recording, don't think of it as you're reviewing yourself. Think of it as you're reviewing a candidate and you are the examiner and what you're thinking. You don't know anything about the candidate. You're just looking at that performance. Okay, so review the performance. Don't be hard on yourself, but be hard on the performance in that recording. So that will help you to mark your cases as critical as you can. If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you get some insights. What you want to do is when it comes to the submission point, you need to have a wide range of good cases. Okay, you want to have this abundance of cases so that you're not feeling that you're having to submit a case that you're not 100% happy with. Having said that, you're not chasing for perfection. There is no perfection here. But what you're chasing for, the aim is to make sure that you're getting good cases that you think will be scoring at least a pass, if not a clear pass. This is what you're aiming for. So what you want to make sure, if you haven't got the mandatory case selection criteria yet, and you're submitting in September, this needs to be your priority. You need to make sure that you've got that, because otherwise you can't submit. And then you need to make sure that you're having at least 3 good recording for each of the mandatory case selection. Because if you have 3 of them, then you can select the best of the 3. That will give you a better chance of having a better selection of cases. This is a common mistake I see some registrars make, is that they're optimizing for the breadth of cases. What you want to do is you optimize for the highest marks possible for overall for the 13 cases. And if this means that you're having to submit 2 cases that lie in the same clinical topic, then that's okay, because you're not going to be penalized for that. Some registrars I've coached have even submitted 3 and even 4 cases within the same clinical topic, and they've managed to pass. So as long as you're fulfilling the mandatory criteria, you're not going to be penalized, okay? So make sure that you optimize for highest mark that you get. There are some cases that can be controversial, or examiners might have a difference of opinion. I would try and avoid these cases. So if you've done something, if you've said something that might not sit very well with examiner, try to avoid this, because then there is possibility that the examiner might mark you down for doing something that maybe in your local area they'll do usually, whereas it might not be seen as good practice. So there are things that examiners might have a difference of opinion. So be aware of that. Beware of your blind spot. Everybody has got blind spot, and the way you get better at it is to have self-awareness, to know what are your weaknesses, what you need to pay more attention to, and also seeking feedback from your supervisor, because your supervisor has got an objective pair of eyes. They will be able to identify things that you may not be aware of. So seek feedback from your supervisor. If you're not sure about a case, whether you think that it's suitable for submission, just get some opinion from your supervisor. Even if you don't agree with your supervisor, at least you got a different perspective, because the likelihood is that the examiner would have possible difference of opinion to yourself, because they have been in practice for many years, and your supervisor has been in practice for many years as well, so they have more experience. Before you submit, so what you need to make sure is your supervisor has verified your cases. What you don't want to be in a position where your supervisor is on leave and you're stressed, your cases have not been verified. So make sure that you got this done a week before submission time. And last but not least, make sure that your submission is compliant. So compliant in terms of patient dignity, the flash area, swimsuit area. Make sure that your recording is of a good quality, that it can be listened without any issues. There's no interruption in the recording, because you will be penalized if you submit any of these cases, and this will be counted as a breach. So you don't want to have that. If you found this video useful, then I'm sure you're going to get a lot from watching this video, where I talk about mistakes that registrars make with the RCA. Click the video to watch it. Take care, everybody. Bye-bye.